Thank you, Chairwoman Eshoo. Today, the committee continues its critical work to improve our healthcare delivery systems, advance access to care, and protect the health and well-being of our country. This markup comes after a very productive Congress on the healthcare front, some of which has been accomplished in strong bipartisan fashion, but there is more work to do, and today the subcommittee will be marking up 5 bills. We begin by considering bipartisan legislation that would improve care for seniors. This bill would improve access to treatment and ensure that seniors are receiving the health care that they're entitled to by streamlining and shortening the time frame for prior authorization in the Medicare Advantage program. The bill would also increase transparency of Medicare Advantage plans and modernize the prior authorization process. We've worked closely with our counterparts at the Ways and Means Committee, and I support this important bipartisan legislation that will help ensure that our seniors are not facing unwanted barriers to accessing timely medically necessary care. We'll also consider legislation that would provide updates and improvements to the vaccine injury compensation program. While serious vaccine injuries are incredibly rare, some individuals still experience adverse events after receiving a vaccine. For those who are injured, Congress created the Vaccine Injury Compensation Program, a no-fault system which provides financial compensation in cases of injury caused by covered vaccines. Unfortunately, the program currently faces a backlog of 2 years due to an outdated and arbitrary cap on the number of special masters who oversee the program. Then there's H.R. 3655, introduced by Representatives Doggett and Upton, would help clear the existing backlog of claims and improve the program's capacity to ensure claims are paid in a timely manner going forward. Patients and their families should not have to wait to have a fair and timely hearing for their claims. I have a number of other bills that seek to improve health care in rural and underserved areas. The Mobile Health Care Act, introduced by Representatives Susie Lee, Hudson Ruiz, and Herrera Butler, would allow community health centers to use new access point grants for establishing mobile health units in order to increase access to health care in these areas. The Improving Trauma Systems and Emergency Care Act, introduced by Representative O'Halloran, reauthorizes grants for trauma care to support the improvement of emergency medical services and trauma care readiness and coordination, particularly in rural areas. Both of these bills provide important improvements to healthcare delivery in underserved areas. And finally, we have the Flint Registry Reauthorization Act, introduced by Representative Kildee and the entire Michigan delegation, which reauthorizes the lead exposure registry. Preventing lead exposure and helping those who have experienced lead exposure must remain a high priority. Continuing this program will allow health professionals to collect robust data, monitor lead exposure, and improve care coordination for people exposed to lead. Now, this is a bipartisan bill. As I said, all the Michiganders co-sponsored it. So I am disappointed that some of my Republican colleagues are seeking changes to this reauthorization in a way that I think would undermine the work underway in Flint. And these suggested changes would also threaten the ability for the registry to continue supporting eligible participants and help inform other communities in the future. So I'm hoping that my colleagues will recognize the importance of reauthorizing this program to support children and individuals exposed to lead and withdraw any amendments that would weaken this bill. But I look forward to advancing all 5 of these bills to the full committee. And with that, I yield back, Madam Chairwoman, the remainder of my time.